Hi, I'm Dan Durrie, and I'm at the Eye Accelerator program, and I love these type of meetings, and it's sure fun to be back together. One of the questions that I get all the time at these meetings is that I think people know that I'm interested in office-based surgery and I'm involved in Iowa Partners, but why is this so interesting to me? And I kind of go back to my history. I started out doing cataract surgery when we were doing inpatient cataract surgery, and I was one of the first people in the country to do outpatient cataract surgery back in the 70s. And that was controversial, but eventually all cataract surgery went outpatient. And then in the early 90s, we started ASCs, and that was controversial, and that became the norm. And then when we started LASIK surgery, we initially did it in the ASCs in the hospital, and we moved it to the office. So I've always felt that the rest of ophthalmic surgery would eventually go to the office, and it's happening now. And one of the motivating factors that I use to decide on a technology or a service is I always look at it in 5 points. And I kind of put my hand up and I say, number one, it has to be safe. Well, there's no doubt that cataract surgery with a good surgeon and good equipment is safe. It's got to be efficacious. And cataract surgery, we can do a great job. But nowadays, we've added 3 more. It needs to be convenient, and doing office-based surgery is more convenient for the patient and the doctor and for the whole practice. And it needs to be cost-effective. So the cost-effectiveness is a requirement for something to succeed. And the last one, it needs to be environmentally friendly. So right now, if you take office-based ophthalmic surgery, and I'm not just talking about cataract surgery anymore, I'm talking about the movement in glaucoma, cornea, retina, cataract to the office. It's definitely safe, it's definitely efficacious, it's convenient, cost-effective, and we make it environmentally friendly because we can control a lot of the supplies that we can't control at the ASC and at the hospital. So it's kind of neat for me to see something that when all those things lined up, it's going to happen. It's kind of like if you think of the internet. You know, it had all those factors. Cell phones had all those factors, big things that happen. And I think this is something that's really going to be a trend for us in the future. And it's great to see meetings like this where people are coming up and saying, I've got an idea for office-based surgery suite in the technology area, in the service area, and all of the strategic companies are talking about it too. So pretty exciting times.